We begin with a major expansion of women's health care in the United States. Federal health officials today approved the first ever over-the-counter birth control pill. The FDA decision means the drug Opill will soon be made available to millions of Americans without a prescription. Women's health advocates are hailing today's news as an important step in reproductive rights in the wake of last year's Supreme Court decision that overturned Roe v. Wade. More than half the country has banned or limited abortion access since the Supreme Court ruling. Opill will become the most effective birth control method available over the counter. Currently, an estimated 10 million women in the U.S. use prescription birth control pills. CBS's Janet Shamlian has the details tonight from Houston. Good evening, Janet.
Norah, good evening to you. This is unprecedented, and it is a game changer for reproductive health care. The easier access is likely to have the biggest impact on tens of millions of teen girls and lower-income women who may not have a doctor.
The daily pill called Opill, which has been available in this country by prescription for 50 years, could be on store shelves without a prescription by early next year.
How big of a deal is this?
I think it's a really big deal, yeah.
Young women.
Dr. Pamela Behrens is an OBGYN and professor at UT Health Houston.
I think having access to birth control is really important for women, and this is another way to get easier access.
More than 3/4 of U.S. women under age 50 in a recent survey said they wanted birth control pills available without a prescription if deemed safe and effective. They're already available over the counter in more than 100 countries. The move was opposed by the Catholic Medical Association.
The medication should not be over the counter. I think a doctor needs to be counseling and discussing this with patients if that's what the patient is choosing.
The approval comes amid increased focus on birth control since last year's overturning of Roe v. Wade. The FDA reports of the more than 6 million pregnancies in the U.S. each year, almost half are unintended. Opill contains the hormone progestin and must be taken at the same time every day to be effective. Common side effects are irregular bleeding, headaches, dizziness, and nausea, as with many birth control pills.
This is a very safe option. It may not be the perfect option for many people.
French drug maker Perrigo hasn't announced a price for the pills, which are sold in 28-day packs, but says it will make them affordable and provide Opill at no cost to those who can't pay.
The pills will be available beyond pharmacies like this, grocery stores, convenience stores, even online. The FDA says they will be available to anyone of reproductive age without parental approval. Norah.
Janet Shamlian, thank you.